Good morning, everybody. Yesterday there were 103,000 tests done in New South Wales, and obviously that is a good number. We want that to keep up. Unfortunately, we had a huge increase in the number of cases of community transmission to 8 p.m. last night. There were 633 cases of community transmission, and at this stage there are at least 62 of those that were infectious in the community during that time. It's really, really important to stress the following point. At the moment, according to the data we have, every person who has the virus is spreading it to at least more than one person. Now, for us to know that we've reached our peak, that can't continue. So what the data is telling us in the last few days is that we haven't seen the worst of it. And the way that we stop this is by everybody staying at home. You cannot get the virus if you do not have contact with other people. You have to assume, no matter where you are in the state, that every time you set foot out of your door, that you have the virus or anybody you're in contact with has the virus. Concerningly, as we've seen from right at the beginning of this outbreak, out of the 633 cases, 550 are still from southwestern and western Sydney. So the vast, vast majority of cases are in younger people in those areas of concern. And that is where our focus needs to remain, although, given the high viral load, it could mean that it could be an outbreak anywhere if anyone from those communities moves to work in another community. Before I move forward to the suburbs of concern, I do want to extend my condolences to the 3 families of loved ones who passed away to 8 p.m. last night. A family of a male in his late 60s who was in Liverpool Hospital, who wasn't vaccinated. 2 males in their late 70s who both passed away at Nepean Hospital. One was unvaccinated and one had only received 1 dose of vaccine. Again, we extend our deepest condolences to the families of those 3 gentlemen and obviously appreciate how distressing this is. And I hope this really reinforces the message that even if you think you're okay, don't risk giving the virus to those you love the most. Some of the stories we hear every day about the way people are suffering, the way people are seeing loved ones dying, the impact it's having is just devastating. So just stay home. Please don't leave home unless you absolutely have to. And we know where the virus is lurking. We know where the problems are in terms of transmission. It's workplaces and households. And we just ask people to heed that advice. As I said, there were 550 cases within those areas of Western and Southwestern Sydney that continue to be a challenge. And the particular suburbs we want to call out are Marylands, Guildford, Auburn, Greenacre, Yagoona, St Mary's and Strathfield. And these are the suburbs of most concern where we're continuing to see an escalation of cases. In Western New South Wales, the Deputy Premier will give further detail, as will Dr Chant. We obviously remain concerned about Western New South Wales, especially in our remote Indigenous communities, and we're just calling out anybody who was in Wilcannia in the last little while needs to come forward and get tested. Please make sure you are on alert. But especially in and around the Wilcannia area, and as we've said in the last few days, there continue to be cases, especially in the West Dubbo community. Now, as you heard yesterday, we have an ambitious task of getting jabs into the arms of 500,000 16 to 39-year-olds in those areas of concern. And can I please call out everybody who's between the ages of 16 to 39 in those local government areas of concern that we've been highlighting to come forward and get vaccinated. We got an extra 500,000 doses from the federal government, which we're very grateful for, extra doses of Pfizer, and that'll be going straight into the arms of those 16 to 39-year-olds in those local government areas of concern to make sure we not only keep them and their families safe, but also contribute to the reduction of the spread. And obviously, if you go to newsouthwales.gov.au, you can now book for your vaccine, and we encourage you to do that as quickly as possible so that we can vaccinate as many people as possible. Now, vaccines are critical, obviously, not only in dealing with this outbreak, but also maintaining the safety of our citizens moving forward, and obviously ensuring that we get back to a normal life as soon as we can. But I just need to remind everybody, when you get your first jab, it takes about 2 or 3 weeks for it to become effective. So don't think you're immune. Don't think you can stop or relax, not wearing your mask when you need to, or not socially distancing, or not staying at home when you should be. So please make sure that when you are vaccinated, don't assume that you can't get the virus or give it on to others. And also, because we haven't yet hit our milestones of having the majority of our population vaccinated, it is still a huge threat to those unvaccinated in the community, for those who are vaccinated, to carry on normal business without strictly adhering to the health rules. Dr. Chant will now give the health update. The Deputy Premier will talk about regional New South Wales. Minister Dominello will give an update on business grants. I want to make very clear that during these difficult times, we don't want anyone going without, whether you're an individual who's had a reduction in your hours of work or you're not working, whether you're a business who has suffered because of the restrictions or the lockdown. Please make sure that services and dollars are available to be put in your accounts as soon as possible, and Minister Dominello will give an update on what Service New South Wales is doing in that regard. And as you all know, this is day 3 of Operation Stay Home, led by the New South Wales Police Force, and Deputy Commissioner Worboy will give an update on the compliance measures. I'll now ask Dr. Chant to give her update.
Thank you, Premier. I can't express enough my level of concern at these rising numbers of cases. We have 633 locally acquired cases of COVID in the community. As the Premier has indicated, every person is passing on the virus to more than one person, so we are continuing to see case numbers increase. Whilst vaccination will be an aid and essential for us getting to a point where we can live safely with COVID, our vaccination coverage at the moment is far too low. We need to push that up as much as we can. But in the meantime, we also need to do everything we can to not come in contact with anyone, to minimise our movements, and to continue to get tested and isolate if you have the most minimal of symptoms. We currently have 462 COVID cases admitted to hospital and 77 people in intensive care, 25 of those whom require ventilation. We have people in their teens, in their 20s, in their 30s, in their 40s, in their 50s, in their 60s, in their 70s and in their 80s. And we know that for every one of those individuals in ICU, particularly those in the older age groups, they have a real and material risk of death. We will see more admissions and more deaths if these numbers continue to increase. We have a collective responsibility to do all we can to stop seeing those deaths and hospitalisations continue to increase. Again, I'd like to pass my condolences on to the families of those who have lost their loved ones, and again reinforce that we are seeing very high rates in suburbs such as Marylands, Guildford, Auburn, Greenacre, Yagoona, St Mary's and Strathfield. Please be cautious wherever you are in the state, but a particular call out to those suburbs. In Western New South Wales, there have been 23 new cases of COVID reported to 8 p.m. last night, and this brings the total case numbers to around 139. There's been a case in Burke. Also, people in the affected area through Western New South Wales and New South Wales more broadly need to be vigilant if they've been in Wilcannia in recent days, because we think that there's been some exposure in Wilcannia. New South Wales Health's ongoing sewage surveillance program has detected fragments in Bathurst and Orange, and again we need those communities to be vigilant and come out for testing. And also overnight we've had a detection in the Yamba sewage treatment plant. So again, we ask that the communities be particularly vigilant. So in conclusion, can I just urge the community to follow the public health rules. Don't try and look for loopholes. You know the intent. Please minimise your movements. Stay at home. We can get through this, and I'm very confident with all the efforts in place that we can, but we need everyone to play their part.
Well, good morning. Can I also start by offering my deepest condolences to those families that lost loved ones. You remain in our prayers. As Dr. Chant touched on, Western New South Wales continues to be of concern for our regional rural communities. 23 cases overnight, predominantly 17 of those cases were in Dubbo, but there are cases in Mudgee, Narromine, Gilgandra. In the far west, Wilcannia has 3 cases, Burke, and the reported case of Broken Hill yesterday. It is clear that this issue in Western New South Wales is where our focus and our priority is, and the message for everybody is to follow the stay-home orders, cut down mobility, make sure that you get tested at the first sign of any symptoms, and at the same time, of course, consider vaccination. Our pathway in the regions also is about vaccination, and book in for your vaccination as quick as possible. In the Hunter, New England, 15 new cases, where 10 in Newcastle, 2 in Maitland and 3 in Lake Macquarie. Illawarra, Shoalhaven, there were 4 new cases, 3 in Shell Harbour and 1 in Wollongong. As Dr. Chant touched on, the sewage surveillance continues to pick up fragments in Yamba, Orange, Wollongong and Bathurst. And overnight, since the 8 p.m. reporting, we know there is a case in the Central Coast and the Mid-North Coast, that being in Kempsey. Armidale and Tamworth, including the Northern Rivers, are no new cases. So my message continues to be the same message over the past few days, that if we want to control what's occurring in regional rural New South Wales, that we don't have the continued growth in numbers, and of course the Western New South Wales is our focus, we need everybody in the regions to do the right thing, because our surveillance, our contact traces, the work we're doing through sewage surveillance, and understanding how contagious and transmissible the Delta strain is, really is putting regional rural New South Wales on that knife edge. So again to everybody, do the right thing and stop the spread.
Well, good morning. About a month ago, we opened up a series of grants for businesses, and today I want to give you a report on those grants. Can I first begin by apologising to all the businesses that did not receive their grants on time or did not receive phone calls when they should have expected phone calls. At Service New South Wales and myself, we pride ourselves on providing great services to the people of our state. It's a service that we built up over 7 or 8 years now that is not just renowned here in Australia but around the world. And the quality of service that we provided over the last month is not up to standard. We are making headway in relation to the business grants, and I'll provide you with the figures today. About 260,000 grants have been received so far. Of the 260,000 grants, about 200,000 have been approved and or paid. That is, 200,000 businesses have either received the money or will receive the money in the next few days. Of the 60,000 odd grants remaining, about 10,000 we are waiting from customers or businesses to give us more information in terms of whether they want to proceed with the grant or additional information. Of the 50,000 then remaining, we still have about 15,000 that is more than 2 weeks old. Now, we've got 587 assessors that is working specifically to make sure that we clear that backlog of 15,000, which represents about 5% of the total amount. Now, across the board, the average time from the grant application to payment is 7.5 days, working days. But again, we still have about 15,000 grants with an average time of more than 2 weeks that we are really putting our best efforts towards in the coming days. In relation to wait times, again, they have not been great. And you would expect that with 260,000 applications, we had a 4,000% increase in call demand at the peak. We've never had this level of demand before. And when we were setting up this grant program, in many ways we were flying and building the plane at the same time. But we are, again, making a lot of progress, and we're reporting that progress daily on a dedicated Service New South Wales webpage. But in terms of call times, at their peak, they were over 2 hours. Last week, they got down to 18 minutes, and now they're under 10 minutes. Again, under 10 minutes is not great compared to what we're used to at Service New South Wales. We accept that, but these are challenging times, and I'd be grateful for your patience. Again, I'm happy to report further, but if anybody wants any information, at 7:30 a.m. we update the Service New South Wales website so that we can have full transparency and accountability in terms of how this grant program is rolling out. Thank you.
Premier, good morning everyone. 736 penalty notices issued in the last 24 hours right across New South Wales by police in country areas in Greater Sydney. It's disappointing, there is absolutely no doubt about that, but when you look at 448 of those issued to people who were moving outside of their house without a good reason, that again shows us that people are clearly want to step outside of the rules and put their own safety at risk and that of their community and their family. A couple of examples is that yesterday police were called to a place called Mendoran, which is near Dubbo. They spoke to a fellow there that had had an accident in his car, had struck a kangaroo. That person told police quite willingly that he arrived about 10 days ago from Queensland. He came to the airport, he hired a car and he decided that he would travel around country New South Wales on back roads because he was sick of COVID, that he needed to get out and about. This person, once he had those difficulties, local people were called to assist him and quickly reported his behaviour to police, and he was issued a $1,000 infringement notice, directed to return to Sydney to a nominated address, and then police checked that he did return to Sydney to that address. Our ADF and police continue their compliance operations. Thousands of those checks, nearly 4,000 checks in the last 24 hours. A man at Padstow was checked in the morning, thought that obligation of police had finished there, and the ADF, he decided that he'd leave his home after lunch in the afternoon. Police were aware that this might occur. They went back to that location, found him away from his home, made a telephone call. He tried to tell police that he was taking the garbage bins out, which was clearly not the case. The man returned to speak to police out the front of his home. He was issued a $5,000 penalty notice. But again, these people need to understand that it's not just a tick-in-the-box check that police and ADF will do. We will understand the people's movements, we will understand the household, we'll gather intelligence and information that makes this process in terms of checking on people that should be isolating, that should be in their home, that they remain good to that and they do not put the community at risk. Thank you.
Premier, what's it going to take here? Is it going to take 1,000 cases a day, 1,200 cases a day before you institute a proper stage 4 lockdown? This lockdown is not as hard as in New Zealand, as in Melbourne. It's clear there's this gap before the vaccination. How many cases a day is it going to take?
Look, we rely on the advice of our health experts. We know that our lockdown is extremely harsh and extremely strict. And we appreciate the pressure that so many families are on because of the lockdown. The vast majority of people are doing the right thing. But what concerns us... Can you just let me finish the answer, please? But what concerns us is, as Deputy Commissioner Worboy's just reported, police found at least 400 examples in one day of people leaving their home when they shouldn't be. In one day alone, police found 400. And what worries us is for every person we find doing the wrong thing, there could be somebody else doing the wrong thing.
There's 8 million people in this state. Of course 400 people are going to be doing the wrong thing. You have to have the right health orders and the right lockdown in place.
We have had and continue to have the right settings in place, but unfortunately too many people continue to do the wrong thing.
So the settings are right, aren't they?
Excuse me, it's not your press conference. There's a lot of other journalists here as well. Can I just say this point? That we know the settings we have in place are some of the harshest that Australia has ever seen.
But not the harshest.
However, we also know that unfortunately it only takes a small number of people to do the wrong thing to cause this amount of spread. That's why I'm urging everybody, stay home. Don't leave home unless you absolutely have to. And I'm also saying to people, we know that there is the light at the end of the tunnel. We know we'll get through this, but it will take us much longer than we need to if people keep doing the wrong thing. Now, I'm really, really pleased that we have so many people coming forward to getting vaccinated. So many tests are happening every day. I mean, yesterday we had more than 106,000 people get vaccinated in New South Wales. That is fantastic. We had more than 105,000 people come forward and get tested. That is fantastic. But we also had too many people doing the wrong thing. And having said that, I know how frustrating this is for the millions and millions of people doing the right thing every day across the state. And I share that frustration. All of us are making huge sacrifices when we think about the loved ones we're not seeing, kids aren't at school. I mean, this is a horrible situation, and it will take us longer if people continue to do the wrong thing. That's why we're grateful at Operation Stay Home. The New South Wales Police have already not only started their operations, but already identified hundreds and hundreds of people in a couple of days alone doing the wrong thing. Imagine if even if out of those hundreds and hundreds of people doing the wrong thing, a couple have the virus and are going around the community spreading it. That sets all of us back. So I can't stress enough, you can have every single rule out there in place, but when people blatantly do the wrong thing,
why does Victoria
it causes
stay at
grief
20?
for all of us.
Why is Victoria 20 a day and your numbers are going up?
Premier, given the numbers that they are going up, the difficulties rising, is it now time for you to stop promising that some restrictions will ease next month?
Well, no, I think that the challenge for us is to make sure that whilst we're asking people to adhere to the strict rules, that we're also asking them to come forward and get vaccinated. The higher the vaccination rate gives us opportunities to think about what we can do to support people that are completely vaccinated during the difficult months of September and October. But what is most important now is just turning the corner. And as I said at the beginning of this press conference, at the moment, there's a technical term called the R factor or the R rating. At the moment, the R effective or the reproductive rate means that every person who has the virus is spreading it at the moment to about 1.3 people. We need that number to be below 1. We need to make sure that whoever has the virus doesn't spread it to anybody else. That's what will turn the corner. And until we hit that corner, we're going to see case numbers rise. And the way we stop case numbers rising is stopping mobility. Stop leaving your home unless you absolutely have to. Everyone is clear on the rules. And all the suggestions that people throw at governments of any persuasion have little impact apart from the margins. The main impact is people reducing their mobility. Don't move around unless you have to. Don't leave your house unless you have to.
Premier, the numbers aren't going up in Melbourne. They're
Dr.
not. They're
Chant.
20 a day, every day, Premier.
Lord, given that, are you now considering any further restrictions? Are you right now considering anything else that you might bring in the next couple of days, or is it essentially up to us to do the right thing?
Well, it's up to every citizen to do the right thing, but it's also part of the police compliance measures, the Operation Stay at Home, which has really ramped up. Commissioner Fuller and the New South Wales Police Force have put in measures across the state to clamp down on those people doing the wrong thing, the minority of people doing the wrong thing. And you can have the strictest rules in place, Delta leaves no room for error. Delta leaves no room for anybody doing the wrong thing.
Numbers aren't going up in Melbourne,
even in other jurisdictions which assumed a short, sharp lockdown would get rid of their handful of cases, have found how stubborn the Delta variant is.
They're not going up there, are they, Premier?
We're getting reports that there remains confusion about the 5 kilometre distance people can be travelling. So, for instance, in LGAs that are really large, like Wollongong, which is 48 kilometres top to bottom, there are people living there that are still travelling 15 to 30 k's to go for a bushwalk or go for a bike ride. Residents are really concerned. There's a number of different shopping centres as well that people can go to. So can you please just clarify, how far can people actually travel for exercise and for going shopping, even if they have a big electric?
Okay, in the areas of concern, you cannot move more than 5 kilometres from your house. So in those local government areas of concern, 5 kilometres, full stop. However, as the Deputy Premier would attest, in many regional communities, your nearest shop might be quite a distance away, and that's why within the local government area is allowable. But can I just be straight about this? If you live anywhere in the state, you should not be going beyond 5 kilometres unless you absolutely have to. That is the bottom line. That is the bottom line. And you shouldn't be leaving your house unless you absolutely have to. But we also have to get the right balance in terms of knowing that in some parts of the state, in some parts of our communities, people need to go further to get essential things. But in those areas of concern, no more than 5 Ks, full stop. No more. But even then, you shouldn't be leaving your house, and that's very clear.
Probably on the areas of concern, Stuart Ayres and the Commissioner publicly said yesterday there would be a change to that rule, that the 5K rule would not apply for people who want to leave that LGO on the border. And you said yesterday, no, that's not correct. Does that mean Mr Fuller has been overruled on that?
Not at all. Can I say that the police have always we've made sure the police always have the powers they need to do the job they want. The Police Commissioner knows that. Without exaggerating, the Police Commissioner and I are probably in touch 10 times a day, as I am with Dr Chant and the Minister for Health and the health people. We are in regular contact about what we need to do in order to see a turnaround. But it is a collective responsibility. It's not government or business or community or individuals. It's all of us working together. It's all of us working together.
Sorry, there's an issue maybe with the public health order. I'm not sure. Is there? If people are still technically allowed to travel, further than 5 kilometres to go to another shopping centre in an area as large as Wollongong?
I think people understand what the rules are. Every time you leave the house, you have to assume you have the virus or somebody else has the virus. Every time you leave the house, you're risking your health and the health of others. We can't stress enough. Minimise your activity, minimise your mobility. Don't go beyond 5 kilometres. Now, these are the basic rules in place. And there are always exemptions. And that's because if you don't put those things in place, communities not only suffer, but then health department would be flooded with thousands and thousands and thousands of exemptions every day. So please know, people know the basic rules, and we ask everybody to stick to those basic rules and know that it's a collective responsibility. And I know I give the same message every day. I know I give the same message every day because some people aren't hearing the same message. Stay at home. Don't break the rules. Everybody knows what they mean. People are just, a small number of people are choosing to ignore what the rules are. And as Deputy Commissioner Worboy said, in one day alone, more than 400 people that police know of across the state, 400, left their house for the wrong reason.
Dr Chant, question for Dr Chant.
I'll get Dr Chant.
That point. In terms of the LGA, is it correct to say that it's not just the geography of the LGA, it's the population within it? So you can have a smaller population in the Sydney, a smaller area in a Sydney LGA that has, for instance, 100,000 people. If the Wollongong LGA has 100,000 people, it's still contained within that same number. Is that not the rationale behind the LGA movement?
Look, the rules are in place to keep everybody safe, and we just ask people, the vast majority of people know what the rules are, the vast majority of people know what the risks are. And it's important for us not to get caught up in the weeds of an issue. What is really important for us is for people just to do the right thing. Please do the right thing. Stay at home. And when you are leaving your home because you have to, only do so assuming that you've got the disease or someone you're coming into contact with has the disease. But every day that our vaccination rates go up, that is an important weapon in dealing with this outbreak. But the most important weapon in dealing with this outbreak is for everybody to do the right thing. And we don't give you every example of when people are doing the wrong thing. But in some communities, when there are illegal gatherings, when people flagrantly disrespect the rules, it is heartbreaking. It causes us heartbreak every day, to see examples of a number of people coming together, knowing they're doing the wrong thing and not caring they're doing the wrong thing. Can I just ask everybody to care? Don't care about us or the broader community, but care about those closest to you. Care about your family, your friends, that you could be causing inordinate amounts of grief. And I just ask everybody to care about their loved ones, even if they don't care about the rest of us, even if they don't care about those people they don't know, care about those closest to you, because you are risking their lives and you're risking their livelihoods. But as far as the vast majority of citizens, please know I get that the vast majority want to do the right thing and are doing the right thing. And we are all sitting at home or really, really concerned that a number of people are choosing to continue to disregard the rules. But I am someone who always knows that at the end of this difficult time, there'll be a time again when we live freely, but that will take longer if people continue to do the wrong thing. And that's why police and ADF have more people on the ground than ever before to clamp down on people doing the wrong thing. And we don't apologise for having that strong presence. We don't apologise for doing that going the next level, because the future of our freedom relies on it.
Dr.
Our ability
Chant.
to get out of this quickly relies on it.
Dr. Chant, please. Dr. Chant, if I can just ask. I've been told that you are in agreement with Commonwealth Health officials that this lockdown needs to go harder, and you have expressed that over several weeks to the Premier, and she is not on the same page as you on this. What is your comment?
Can I just indicate the fact that the Premier is very committed to achieving the same outcomes. We have a shared vision which is high vaccination coverage and very low levels of community transmission. I can't restate that. I can't comment any further than say the Premier, in all my discussions with her, is absolutely committed to increasing vaccine coverage and getting low community transmission.
Why is it shut in Melbourne and New Zealand that aren't shut here, Dr. Chant? Why is 25% of construction only open in Melbourne? Why can't you play golf in Melbourne? Why is there a curfew in Melbourne? They've got 20 cases a day, there's 633 here. Why haven't we got tighter rules here, except the Premier stubbornly refuses to introduce them?
So look, I'm not going to respond apart from saying that the Premier and I are both committed passionately to seeing the case numbers decline. I cannot stress that even with high vaccine coverage, we cannot do well with the case numbers we've got. So the challenge for us as a community is to work together to get those numbers down. We need to see the numbers very low in terms of case numbers, and we need to see the vaccine coverage very, very high. So my key message is please get vaccinated. We have 2 very good vaccines. Access points in the community are increasing. And can I thank the hard work of the GPs, our own state services and pharmacies in rolling out and bringing the vaccine accessible to the people. We have the tools, but we have to also address the issues that are leading to ongoing transmission.
Dr. Chairman, what are they? What's the explanation? This is a huge jump. I have seen people doing the wrong thing, but why such a jump? Is it just people doing the wrong thing going into different households, or is there another explanation for such a jump in cases?
The communities of southwestern Sydney and Western Sydney are a resilient community, and I think it's also very important to reflect on the fact that they've been experiencing some of the harshest lockdown conditions anywhere and restrictions. It is important to note that a lot of the essential workers that keep our economy moving, and I mean that in terms of the basic economy of putting food on our tables, our essential items that we need for our life, live and work in southwestern Sydney, and they also work outside those areas of southwestern Sydney and Western Sydney. So what we are seeing is workers from those areas doing the fantastic work they do in supporting disabilities, supporting aged care, working in factories and cleaning and other things, going into workplaces, leading to transmission, and then transmission occurs and then a seeding of another household. We also know that some people, there are a small proportion of people, are not perhaps taking COVID as seriously as I would like them to do. And then what's happening is they're potentially going into multiple households. So, for instance, you might have one person who has connections across 3 households, but in each of those households, you've got tens of people. And we know that household transmission for COVID is so common. We're also seeing outbreaks in childcare centres, and that's a feature we haven't seen in previous outbreaks because the Delta strain seems to be able to transmit more in the childhood setting. These are all challenges we need to work collectively for. But can I also reiterate, even the comment before around, can you go 5K or can you go to shopping centre or whatever? Our clear message is shop local, stay local, and spend the least time in a place where there are other people that you can. So please be purposeful in your shopping, make a list, and do not linger, and stay distant and wear a mask.
Dr. Chant, can I just ask you, it was an important question that Andrew asked before, and you didn't quite answer it. Is there a fracture between your vision? You have a shared vision with the Premier, no doubt. You want New South Wales to be healthy and prosperous and to get out of lockdown. The question wasn't about a shared vision. The question was about a methodology on how you achieve that. The people of New South Wales deserve to know if you have given health advice to the government. I appreciate the position you're in, but we're looking for the truth here. Have you given health advice to the government that has not been adhered to? Have you suggested a harsher lockdown is needed and that advice has been ignored? It's a yes-no answer.
No, it's not not as easy as that. What we do is define the problems. So we define the settings that transmission's occurring, the fact that we need to decrease mobility, we need to reduce presence at workplaces, we need to keep activity to the most essential. Those are the objectives we need. What we need to do is then have that informed by how is the best way to achieve that, because we do not understand the critical logistics of where we may lead someone to have food insecurity. We don't understand, the requirements on fire brigade who might have staff join from a particular point. So we can comment from public health perspective. I want to see less people in settings where there's other people. So that includes workplaces, childcare centres. We've made it clear about our position about educational settings. So from my perspective, I want to see the less people in settings where there are other people.
Are you seeking harsher restrictions?
I'm just commenting on the fact that with the R effective, above 1, we are seeing growing case numbers. We need to drive that R effective beneath 1, and I am committed strongly to be saying that that is what we need to do.
Are there other settings that we can...
Sorry, just on childcare centres, that's quite a specific one, and it is a problem, and you've said multiple days in a row childcare centres are a problem. People are still sending their kids to school, to childcare centres, when they're at home, because they're working from home and it's hard. Do you need to clamp down on who is sending their child to a childcare centre?
I've been very clear that what we're asking the community to do is to not send children to childcare if they, unless they absolutely need to, and if they're just working from home, that wouldn't be, in my mind, a reason to do it. That is critical. And as I said, I want to see decreased attendance across all workplaces, and I think this is a shared responsibility. Industry, government, us as individuals have a responsibility to do this.
A lot of local mayors are quite angry to learn that their areas aren't being tested with the sewage. Is it true that there's around 60 of a possible 157 sites being tested? And given it's such an important warning signal, can we do them all?
We are ramping up our sewage testing capability, and we've also reprioritised our rural testing over some of our metropolitan testing, which becomes less useful when we have high case numbers. So we are definitely trying to make space. There are some logistic challenges to get the samples in a certain state, and they have to be collected at the peak flow. So we are working with a number of regional councils to expand, and I'm actually really pleased that so many councils want to come on board with sewage surveillance. It is a very useful tool, and I look forward to expanding that program. But obviously, we have finite resources while we're scaling, and we need to prioritise our samples.
Are there any other settings that you would recommend or that you are considering to bring that R rate down, to stop mobility, as you say, is our main goal? Are there any that you are considering, or is it your health advice that we have reached the ceiling of restrictions in New South Wales and this is as far as we can go?
So look, those are a matter for discussion that we have regularly with the Premier, and we will be as I said, we continually reflect on the data, any intelligence we're getting from how transmission's occurring, and keep on updating our ideas and concepts, and they need to be tested because we need to make sure that we don't create more harm with some of the settings we might propose, and that they are tested. Any concepts we might come.
So that means you have suggested some extra settings?
We have ongoing discussions about what more can we do. Obviously, the Premier has been very clear that our reproductive rate, our effective is above 1. We need to get that below 1, and we need to, and from my personal view is we need to get it as low as possible so we can see that the case numbers can decline as rapidly as possible. But there's a range of strategies already that have been announced, and there is a lag in the figures. But obviously I'm concerned. I cannot say other than the fact that I'm incredibly concerned.
Dr. Chant, we've had construction back. We've had construction back. Can I just ask, the obvious requirement around that was that you had to be vaccinated from those LGAs. How many people have you got out there checking that that's being adhered to?
Look, I think that's a matter I'd have to take up with industry, who has set up, I think, understand that there were discussions with industry. I'll have to get back to you in relation to that.
So who's in charge of that inspection process, if there is one?
So I believe that that's within the responsibilities of the employers, but I will take that on notice. I'll let you know.
Just on children transmitting the virus, a lot of these children are obviously not yet eligible for the vaccine, especially that cohort from 12 up. How eager are you to see ATAGI approve the vaccine for them, and are you preparing plans on how you're going to vaccinate them when they are approved for it?
Look, I firmly believe we need to get in and vaccinate our 12 to 15-year-olds at the moment. We've vaccinated the 16-year-olds. I'm really keen to get into the 12 to 15-year-olds personally, and I await the advice around that more routinely. Certainly we do vaccinate children with underlying conditions down to that level. I think that we are watching internationally the evidence around younger children, but I think that given the transmission of Delta, it may well be that in future we do provide vaccines in the younger age groups, but those are a matter that ATAGI is watching, and we obviously always follow the advice of ATAGI. I think we need to respect the scientific approach, but as I said, personally, I believe that we will be doing targeting school-aged children, particularly the high school children, very quickly, because we know they do contribute to transmission.
Mr. Hazzard, can I just ask you a question, sir, about last night we aired on 7 News a fleet of ambulances waiting outside a Sydney hospital with COVID-infected people with nowhere to go. How much of the concern is the government is not just for the health of people, but for hospitals' ability to cope now that we are into the 600s and it's going to escalate? And the second part of my question, is it true that a vaccination hub at Westmead is being closed down? And if so, is that to make way for more COVID patients?
Second part of your question, Robert, I don't know. I haven't been advised, but the operational team, we can find out from the operational team because we've got scores of obviously sites now across Sydney and the state. As to the first issue, I did see your story, and I actually spoke to the hospital management this morning and the ambulance commissioner just to see what was going on. There's no question, as I've said a number of times, that the health system is under stress, but what's happening at Westmead is a challenge, and they had a number of ambulances where normally, pre-COVID anyway, any of those sort of situations would be because there was a blockage in the ED, that is too many patients arriving at one time rather than a steady flow, and some of those would have to be transferred out to the wards, and the blockage therefore would be usually from the wards. But what I'm told is that in this particular case, the ED, the emergency department, is trying to manage people who could be potentially COVID exposed, not necessarily in the ambulances. So what they're doing is they're trying to work through a logistical system, a better flow system within the emergency department to allow the staff not to be exposed and other patients not to be exposed to people coming in who may have it before they know it. So they're trying to do
that image alone. I mean, it shows that the hospitals really aren't coping at the moment, doesn't it? I mean, just that.
As I've said before, Robert, and I've said it a number of times now, that obviously the health systems in New South Wales is under a degree of stress, but the staff are doing a really good job. And I think I want to thank the nurses and doctors in the emergency department who are trying to look after patients and doing a first-class job. Westmead's an outstanding hospital. And obviously at the same time the paramedics are bringing the patients in with a range of issues, but they're also having to check whether or not they are COVID positive. So they're implementing some changes, I was informed, just to try and do some testing actually outside. Hopefully your cameras won't be out there saying this is a disaster, because it's not. It's simply that they're managing patients outside to make sure that they're doing COVID tests before the patients are actually taken in, because that allows them to know how the flow should work in the emergency department.
Last question.
Sorry, just one from Ashley, and then I'll...
Just on breastfeeding New South Wales, are there any talks to try and reverse that decision? Obviously there's lots of people concerned when that came to light yesterday.
Yeah, look, I've spoken to the health team this morning, and I want to stress again, as I did yesterday, that if a woman has any symptoms at all, she should go to her GP. And the GP can order all those same diagnostic tests. So there should be no immediate concern at all for that. And I've spoken to, as I said, not only, well, a number of senior health officials who have confirmed that that is the case. So I don't think there's any cause for concern. But the balancing act here is it's very close proximity, as any person who's had obviously a breast screen would know. There's the staff and the woman in a very close proximity. The reason that they've actually stopped just the surveillance is that the risk factors, because there's a substantial number of cases of COVID obviously currently, that the risk factors outweigh the benefit for the system and for the individuals. Because if you had a lady who came in and she happened to have a staff member there who was close and that staff member did have COVID, as we've discussed a million times, you can have COVID without actually having any symptoms at all. That's a risk for the patient. But if the patient has any concerns, I stress again, go to your GP. That's the advice I've had from the most senior health officials in the state. Go to your GP, have a talk, and they will refer you to the appropriate screening that can take place.
Last question, please.
I'll give them two parts, sorry. The first one, apparently police have asked councils of concern to lock up playgrounds, remove basketball hoops, etc. as a social distancing measure.
So can we do that one? And then
yes, and
yeah.
Why is that necessary?
Yeah, I think that what police are after is a shared responsibility around any areas of exercise or recreation. If we go right back to the start in terms of COVID-safe plans by businesses, councils, people who own entities, if that COVID-safe plan represents value in terms of those exercise areas, police would be fully supportive of that. But what we're asking is that local government work with their local emergency management and their local police to make areas safe for the public.
And will there be any grace period surrounding the regional permits, given that they can't apply to them until Friday, and they come into place on Saturday?
I think Commissioner Fuller has made it very clear that the rules are the rules. The time for grace periods and the time for being in a position where people can wrangle their way out of it with some excuses are over. People now cannot travel without reasonable excuse outside of Greater Sydney. The permit system allows us to investigate that. It puts more onus on the person themselves. And I must say that if people think that they can use an excuse that's about travelling outside of Greater Sydney, if people think that they can trick the police or see the police not make investigations, they're sadly wrong. The time is over. Commissioner Fuller is very, very clear that the operation, and we've seen the last 3 days an increased police presence right across this state, it will continue, it will not go away until such times as we get out of this situation. Thank you.
Can regional New South Wales expect the statewide lockdown to extend beyond this weekend, or are you still looking at LGAs that could be let out if they don't have any cases?
I think it's premature to have that conversation. You know, we said it was a 7-day lockdown. We'll go to crisis committee, look at all the data that is in front of us. But, you know, look at the numbers today, the number of LGAs and communities that have now infection. Our surveillance, our sewage surveillance is telling us there's concerns in bigger parts of the regions. We've got an issue now in the mid-north coast. So it's a 50-50 call, one that the crisis committee will make, but one that will absolutely be upfront with the community sooner rather than later. Thank you.